Sexually transmitted diseases, or most commonly known as STD. Such diseases have been an increased risk when it comes to adults to teenagers, as it is passed or transmitted from one person to another through sexual or intimate contact or simply intercourse. Such risk could be avoided through the practice of sexual fidelity with only one person whom you know is uninfected. Before we start our study of diseases of the reproductive system, we'll first identify the 4 common STDs in this lesson, which include the usual symptoms, transmission, and the treatment which could be used to cure the disease. With that, let us start. Chlamydia. Chlamydia is a common STD that can cause infection among both men and women. It can cause permanent damage to a woman's reproductive system. This can make it difficult or impossible to get pregnant later. Chlamydia can also cause a potential fatal ectopic pregnancy or a pregnancy that occurs outside the womb. Now, how are chlamydia transferred? Chlamydia could be transferred through sexual contact, and in the case of newborns, it could be transferred through the passage of an infected birth canal. Symptoms. Symptoms of chlamydia in females are painful urinations, abnormal discharge from the vagina, bleeding between menstrual periods, or abdominal pain. In males, usual watery discharge from the penis, and painful urination. While in newborns, it could be eye and lung infection. The treatment to such disease is the infected person and their sexual partners must be tested and treated with antibiotics, and sexual activities must be avoided until the disease is cured. Genital herpes. Genital herpes is a common sexually transmitted infection. The herpes simplex virus or HSV causes the genital herpes. How are genital herpes transferred? It could be transferred through the contact with blisters or with viruses shed by an infected person with no blisters apparent. In newborns, it could be transferred through the passage of infected birth canal. What are the usual symptoms? Symptoms of the genital herpes could be cluster of tender, painful blisters, swollen glands, fever, achy feeling. In newborns, it could vary from mild symptoms to brain damage and death. Treatment. Treatment to genital herpes is infected person should avoid sexual activity. When blisters are present or when viruses are being shed, condom use is advised by doctors, and simply there is no cure. Gonorrhea. Gonorrhea is an STD that can cause infection in the genitals, rectum, and throat. It is very common, especially among young people ages 15 to 24 years old. Now, how are gonorrhea transferred? Gonorrhea could be transferred through sexual contact, and in the case of newborn, it could also be transferred through the passage of infected birth canal. Symptoms of gonorrhea. Symptoms of gonorrhea in females are discharge from vagina or birth canal. In males, abnormal pus discharge from penis or painful urination. While in newborns, it could be eye infection. What are the treatments? Treatment to gonorrhea is the infected person and their sexual partners must be tested and treated with antibiotics. Sexual activities must be also avoided until the disease is cured. Syphilis. Syphilis is a sexually transmitted infection that can cause serious health problems without treatment. Infection develops in stages: primary, secondary, latent, and tertiary. Now, how can syphilis be transferred? It could be transferred through sexual contact or congenital. In the case of newborns, it could be passed through the passage of infected birth canal. Now, symptoms of syphilis. Symptoms of syphilis in the first stage is painless sore that goes away after about 1 to 5 weeks. In second stage, it could be body rash, hair loss, flu-like symptoms, and swollen glands. In newborns, it would be damaged skin, bones, eyes, teeth, and liver. The treatment to syphilis is the infected person and their sexual partners must be tested and treated with antibiotics. Sexual activities must be avoided until the disease is cured. Other diseases of the reproductive system. Epididymitis, or the inflammation of the epididymis. The symptoms of epididymitis is pain in the testis, redness or swelling of the scrotum, hardness or soreness in the affected testicle, groin pain, chills, fever, increased pain in the testis, discharge from the penis, and blood in the semen. Treatment to such disease is enough bed rest, antibiotics. The patient needs to wear an athletic supporter for several weeks and hot bath to ease the pain and help relieve swelling. Prostate cancer. Prostate cancer is a disease in which cancer cells grow in the prostate. Now, symptoms of a prostate cancer is no obvious signs or symptoms. Early stage prostate cancers are detected only through a digital rectal exam. Frequent urination. The patient gets up often during the night to urinate. Pain or discomfort while urinating, blood in the urine or semen, and back pain. The treatment to prostate cancer is it involves surgery and hormonal therapy. Radiation therapy and chemotherapy may also be used. Male infertility. Male infertility, a man is considered infertile if he produces low amount of sperm cells. The sperm cells are abnormal or they die before they can reach the egg cell. It is caused by inherited conditions like chromosomal abnormalities. The symptoms to male infertility is simply inability to conceive and baldness. Now, the treatment to male infertility could be structural or hormonal abnormalities must be corrected or accomplished through medications or surgery. Lifestyle changes and other treatments like assisted reproductive treatment or ART may be used to enhance the productivity of semen. Next is cervical cancer. How are cervical cancer produced? The cancer cells grow in the cervix. The cells keep dividing in a regulated manner and there is a presence of a mass of tissue in the cervix. Now, what are the symptoms of cervical cancer? The usual symptoms will be bleeding between regular menstrual periods. The menstrual bleeding is heavier or lasts longer than usual. Bleeding after sexual intercourse. Bleeding after a pelvic examination. Increased vaginal discharge, and pain after sexual intercourse. Treatments to cervical cancer will be surgery, radiation therapy, chemotherapy, or biological therapy is used. Next, we'll be tackling about the common disorders of the female reproductive system. Dysmenorrhea. Dysmenorrhea is characterized by severe pain during menstruation. Amenorrhea. Symptoms of amenorrhea is abnormal absence of menstruation. Next is oligomenorrhea. Symptoms would be abnormal and infrequent menstrual period. Sterility. Symptoms of sterility is the inability to reproduce offspring. In females, the fallopian tubes are blocked, which can cause the failure of the ovaries to produce eggs. Vaginitis. A vaginal infection or irritation. One of the symptoms is burning sensation during urination.
Thank you for listening. Thank you for listening. Thank you for listening.